Our parliamentarians have had just no time to discuss the poisonous air in the Delhi National Capital Region. But at News 9, we continue our continuous focus, bringing what matters to you right to the fore. Delhiites are breathing what many now describe as a slow sigh of death, choked by toxic air that refuses to clear year after year. Yet, in a claim that may leave many stunned, the government says there is no proven direct link between breathing Delhi's polluted air and lung diseases. In a written reply in the Rajya Sabha, Environment Minister Kirti Vardhan Singh said there is no conclusive data linking high air pollution levels to lung illness. At the same time, the minister admitted that the air pollution can trigger respiratory problems. He was responding to BJP MP Lakshmikant Bajpai, who raised concerns over rising cases of lung fibrosis and declining lung function in Delhi-NCR. Surprisingly, this is not the first time a minister has said this, while the citizens continue to breathe toxic air without an option. The government have been in constant denial, from MOS, Health, Pratap Rao Jadhav to Union Environment Minister Bhupender Yadav to Delhi Chief Minister Rekha Gupta. Everybody has at least once denied that air pollution is not a life-threatening thing. But what is this? Is this really true? Well, multiple national and global studies paint a very different picture, linking air pollution to millions of deaths in India and severe long-term damage to lung deaths. And while policymakers debate definitions and data, citizens continue to inhale poisonous air with no real escape. Because outside Parliament, global and Indian studies consistently have warned that air pollution is killing millions in this country and permanently damaging lungs, especially in cities like Delhi. The question now is simple. How long can denial survive when the air itself is turning deadly? And I'm being joined by Dr. Vivek Nangia, Vice Chairman and Head Pulmonology, Max Saket, as well as Dr. Sanjeev Gera, who is a Director and Head for Interventional Cardiology, Fortis Hospital. Thank you very much, both of you, for joining me and taking the time out. This possibly is also a very, very busy season for both of you. Dr. Sanjeev Gera, let's just ask a very straight question. Do you agree with what the minister has told the Parliament yet again?
I don't know. I really have some doubts that definitely this is a true statement that it can trigger or it can actually precipitate the pre-existing lung disease, especially if someone has got asthma, maybe he's on steroids, maybe he's on inhalers. That can be precipitated. But we actually do not have that data that it initiates lung disease. As you can't have those randomized things or randomized trials or studies to prove that these people have got, but definitely we are seeing declining lung functions, as Dr. Nagia would agree with me, and we have found in our PFT reports also that we actually from metros we get mild to moderate respiratory restrictive disease in PFTs or lung function test, so which is actually questionable.
Okay. Dr. Nangia, let me just come straight to you at this point. Dr. Nangia, you have been talking about this issue for so long. Have you welcomed what the minister has said? Does it back your research and your understanding?
So I think, it's not just a local problem. Air pollution is a global problem and has been recognized globally to be the single biggest environmental health risk factor by WHO itself, the World Health Organization, which has recognized it. They also recognize it as a silent, invisible kind of a killer. Of course, it's visible to us now. And also that studies that have been done in the Western world, of course, as Dr. Gera also said, we may not have as many studies from our own country, but studies that have been done from the Western world, they've all been done where the AQI is never so high as we're experiencing here in India and Delhi NCR especially, in fact, along the entire Indo-Gangetic belt. So as far as our knowledge about air pollution damaging our lungs or our health or risking our lives is concerned, it dates back to 1950s. In fact, 1952, the infamous London smog was the first episode or the first incident that actually woke us up that there is a problem with the air that can lead to death. That was the time that from 4th to 8th December, in just 4 days, they reported some 4,000 deaths. And later on, the number rose to 12,000, and
Right.
about a lakh of people fell sick because of the polluted air around them. So from then till now, there have been so many studies over the years which has shown that it can actually result in mortality. In 2015, the mortality across the globe was about 9 million deaths because of air pollution, and this number was 3 times higher than the deaths caused by malaria, TB, and AIDS, all of them put together. So the quantum is phenomenal. In fact, in 2024 also, there's a study report which has shown that this has become the second most significant risk factor to our health after blood pressure in the adults and after malnutrition in children.
Okay.
So the second most hazardous factor for our health.
Dr. Sanjeev, while you're mentioning all these things, let's just take our viewers. My team has put together a list of various studies, and it's there on our screen as well. Let me just go through this. In 2020, ICMR study in Lancet Planetary Health said 1.7 million deaths in India in 2019 were linked to air pollution. This is ICMR's study in Lancet Planetary Health. This is not an international standard alone. UNICEF study has accounted globally, as you were mentioning, that this is not just a local India problem or a local national capital problem. Air pollution accounted for 8.1 million deaths globally in 2021. 2025 Lancet Countdown report says fossil fuels and biomass have caused 1.6 million deaths in India in 2021. These are the different studies globally as well as in India, and we have more studies on a screen as well to show this. Now, if you have these studies, these experts, ICMR is not a local body. It's perhaps the best body of medical experts, as it were. At a time when the country is grappling with what it is, ministers time and again have made remarks such as this. And if we could have those remarks as well from ministers, several ministers for that matter over the last few years have made statements such as these. How do you look at it as a doctor? Look at me. I'm choking and coughing when I'm speaking to you over the last few days.
So this is actually, we have to take into account. This is a reliable data actually from these major studies from UNICEF or ICMR. You can't negate these things, and it is a practical thing. When I practice in Noida, when I try, I don't have any asthma, and there are many examples. So even if I enter Delhi, I start, my eyes start burning. I start coughing, dry cough, allergic cough, so many things. So even if it is not causing lung disease, but there is an allergy problem. You can have allergic bronchitis also after pollution because there are so many pollutant chemicals there. So I don't think that we should deny that AQI, or maybe there is no data that this level of AQI lung disease, but definitely air pollution is the reason for growing lung disease, heart disease, blood pressures, heart failures, rhythm disorders, everything. And we have concrete evidence that air pollution definitely is one of the risk factor for having heart disease.
So when both of you are talking so much and the whole country is talking about this, medical practitioners have been talking about this, doctors have been talking about this, let me ask you, Dr. Nangia, what do you make out of what you saw in the parliament? A lovely debate, a very heated debate, if I may say. It's ironic that I'm being very ironical. That should have been a debate that happened in the parliament, but the MPs have had no time for it. They don't think it's important business enough to have that when people are choking on poisonous air. How do you see what's happened in the parliament?
Sorry, I'm not aware of this debate, but as far as I'm aware, I think at least the parliament also has woken up to this in so many years. After so many years, they've at least woken up to this problem of air pollution. And I'm sure that very soon they'll be able to find a solution also to it. Of course, the solution is not so easy, considering that, again, it's not a local problem of Delhi alone. It's the entire country, the entire Indo-Gangetic belt, which is suffering. It will certainly take them time, but I always feel there are certain things that we could do at our own level, at least to keep our indoor air clean. That's also equally important because there are studies which have shown that even the indoor air could be at least 20 to 30 times more toxic than the outdoor air. Please, let's remember that we don't stay in airtight compartments. So whenever you open your door, your window, there's a cross ventilation, there's air coming in and going out. So that also can be very, very toxic and very harmful. So I guess everybody should try and do their bit in controlling the air pollution, and especially the indoor air. If you can make it healthy, there is nothing like it. Because if you see you're spending 80% of your time indoors, whether that's your office, whether that's your home, whether that's your school, college, wherever, or even the shopping malls, that's all considered to be indoors. You're practically your time, as Dr. Gera said, when you're traveling from Noida to Delhi, 1.5, 2 hours in a day that you're traveling, that is the time you're getting exposed to the outside air. Rest of the time, of course, most of us are indoors. I wouldn't talk about the people who are, street vendors and the rickshaw
Right.
pullers and all those people. Of course, they're also suffering as much because of the air pollution. But at least, whatever we can do, we should do.
Right. Very quickly to you, Dr. Sanjeev Gera, are you disappointed that the Parliament did not have any debate at all on this? Second question that I do want to ask you, and I want both to take both of you on it, but Dr. Gera first. Is it time that now the centre and the Delhi government, not just Delhi, Uttar Pradesh, Haryana, all the NCR governments as well, they start allocating budget for air purifiers or related amenities?
Yeah, so I'm not that much aware of the debate which underwent there, but definitely they are in denial mode, and they are not actually correlating air pollution as the sole risk factor for having pulmonary or lung disease. They are saying that it can precipitate, but it is not actually the initiating factor. So that has to be debated a lot, and especially pulmonologists across our country from different cities, they should sit and have a debate with politicians. I think I can propose that, and show them the data, the previous year's data, and which will actually definitely prove that air pollution has something to do with lung disease. And other thing that, like Dr. Nagia said, that our indoor airs should be very purified by air filters, air purifiers, or when we go out, then I think government should provide to everyone, especially those poor people who are wandering and roaming around in Delhi in heavy pollution with N95 or N99 max, which actually prevent some of the pollutants going inside our lungs. So there should be one strategy then to deal with heavy traffic which is actually moving in and out of our metros, especially Delhi. So there should be some rule that this number of cars should not go after 10 kilometers into the city. There should be park rides and park and ride type of thing outside the city. So there can be many solutions.
Right.
Total electric cars. So these things can be actually thought of.
Dr. Sanjeev Gera, I think it's very interesting what you have said, that you and many other doctors along with you would like to debate with the parliamentarians and the ministers about just the ramifications of what's happening. And I think that's something that the country will really benefit from, and hopefully the government should be able to listen to doctors and experts beyond the echo chambers as well. But Dr. Vivek Nagia, one of the last questions to you, could you just tell our viewers what's in store for them? What are the kind of, people will have to go out, people will have to work, people will have to do their day-to-day chores, which is beyond just the four doors of a sanitized space with air purifiers whatsoever. What are they in store for? What are the kind of hazards that they're really looking at in terms of illnesses?
So I think in one line, I would say that there is a reduction in the average lifespan that is expected. There's something called an average life expectancy, which is actually going down. So if it was 74, 75 years is what is expected in India, if you see the study which was published in 2023, which has clearly shown that in overall our country, because of the air pollution, the life expectancy has gone down by 5 years, and in Delhi NCR per se by 11.9 years. So apart from this, of course, it could cause heart attacks, brain diseases, early dementia, uncontrolled blood sugars, arthritis. Besides that, the lung issues are the lung cancer, COPD, asthma, allergies, respiratory tract infections, and greater impact is on the pregnant ladies, even on the unborn child. It could result in intrauterine growth retardation, premature deaths, premature deliveries. poor lung function development in the children, respiratory allergies, asthma and all in children, and even early onset brain disorders in children is what is being seen because of the air pollution.
Absolutely. These are very, very worrying data that's right there out in the open. Dr. Vivek Nangia, Dr. Sanjeev Gera, thank you very much for joining us with your insights.